Greetings from Blockbuster News from BlockPro. Here is the latest news in cardiology compiled just for you in a small video capsule. Here are the headlines. Implications of atrial fibrillation for guideline-directed therapy in patients with heart failure. Drug therapy for arterial hypertension and atrial fibrillation in frail patients. Are there any new insights and recommendations? Effects of prolonged face mask use among patients with hypertension or diabetes during the COVID-19 pandemic. And the latest books in cardiology. Now, the news in detail. Journal of American College of Cardiology State-of-the-Art Review published in March 2024 studied the implications of atrial fibrillation for guideline-directed therapy in patients with heart failure. The prevalence of atrial fibrillation and heart failure is increasing globally, and this trend is expected to continue owing to an aging population and increased life expectancy. The article highlights atrial fibrillation and heart failure commonly occur concurrently, and the combination is associated with worse prognosis than either condition alone. Guideline-directed medical therapy for heart failure can reduce the incidence of atrial fibrillation. The next featured article is titled Drug Therapy for Arterial Hypertension and Atrial Fibrillation in Frail Patients. Are there any new insights and recommendations? Cardiovascular diseases exhibit a considerable interdependence with frailty. There is a disproportionate syndromal interdependence between heart failure and frailty, and the typical aging processes of the sinus node can be interpreted as heartbeat frailty. The article recommends, when initiating antihypertensive therapy in frail individuals, one can consider monotherapy in a departure from the standard case of dual combination therapy. The optimized study showed that discontinuation of one blood pressure medication did not lead to better tolerability of the drug therapy. Now, here we have an interesting study focusing on effects of prolonged face mask use among patients with hypertension or diabetes during the COVID-19 pandemic, featured in Journal of International Medical Research, March issue. The study compared change in blood pressure and fasting plasma glucose in patients with hypertension or diabetes and adjustments to treatment between the group with prolonged mask wearing group, that is greater than or equal to 20 hours a week, and the control group, less than 20 hours a week. The study concluded prolonged mask use by patients with hypertension or diabetes has negative effects on hypertension and plasma glucose control. BP and plasma glucose monitoring should be improved in these patient populations, and their treatment should be adjusted in a timely manner. You would surely be interested in knowing about the new books released this month. Sports Cardiology by Elsevier, Mayo Clinic Cardiology, 5th edition.
Mistake-Based Learning in Cardiology by Elsevier.
For more such interesting news in the field of cardiology, tune into Blockbuster News from BlockPro. For more details, please contact our IPCA Cardinova representative. And stay tuned for the next episode of Blockbuster News from BlockPro.